This is my camera. Let me know when you're ready.
This is mine.
2,
Call me.
1.
Hey guys, Dr. Triggs here. Welcome to Triggs Table Talks. Today I have a special guest. I guess all my guests are special, but a very special guest, my classmate in the Harry class of 2013, board certified obstetrician and gynecologist, Dr. Tamika Cross, also founder of the movement, What a Doctor Looks Like. So Tamika, welcome to Triggs Table Talks.
Thanks for having me.
I'm glad she flew all the way into Houston to do this favor for me. So I just think she's such a dope person, such a dope personality on social media as in person, and a great, great surgeon. So I felt like everybody had to know about you, at least from my standpoint. So I'm happy to have you here. Don't be nervous. It's just, informal, you know what I'm saying? So I know a lot about you, but a lot of my followers may not. So just tell the people like who you are, like where you came from, and then, what sparked your interest in like even going into medicine.
Yeah. So, as you said, I'm Dr. Tamika Cross. I am originally from Detroit. I went to the University of Michigan
Oh, God.
for
Michigan beat Alabama in the Rose Bowl. I was there too.
and did. Um, so, I went there for undergrad, and then I went to Meharry for
Yep.
medical school
Yep.
where we met. And then I finished my residency at University of Texas,
Right.
Houston, McGovern Medical School.
Okay.
And then just stayed there in Houston because I love Houston. I love the warm weather.
Right.
So I worked as assistant professor at UT for 3 years,
Okay.
and then made a transition to private practice
Okay.
in 2020.
How was that transition going from like, basically having a boss to becoming like your own boss, like, transition from academics to private practice?
It was different. It
Yeah. You don't get taught that in med school or in
at
residency, right?
all. I wish we had learned more about the business side of
Right.
medicine. So it's a lot, like just learning about insurance
Yep.
and billing and coding. So all that stuff was self-taught.
Right.
Just buying books and
Mm-hmm.
teaching, myself that. But it was tough. I mean, I like it. I like the autonomy that I'm able to kind of create the environment that I want
Right.
at my office. But it's also tough because it's like at the end of the day, it's like you're in charge of everything.
Right.
Payroll,
Right.
paying the bills, keeping the lights on.
Employee turnover, all that kind of stuff. Yeah, that's the stuff you never really think of. What made you get into obstetrics and gynecology?
So, remember second year how we did like those shadowing? It was
Yep.
before we started our
Mhm.
clinicals.
Yep.
So, I got assigned to OB. I was
Mhm.
like, I don't want to do this.
Yeah.
And then I was
What were
like,
you thinking before OB?
pediatrics.
Okay.
Yeah.
Yeah.
I went to medical school thinking I was going to be a pediatrician.
Yep.
And so when we did the rotation for that, I was like, this is kind of cool.
Yeah,
I was like,
yeah.
I like this. And it was so much more than just delivering a baby. I thought
Right.
OB, I was like, okay, delivering babies, looking at vaginas all day,
Mhm.
not interested.
Yeah.
But it was so much more.
Right.
And so I liked that I can go from the OR to the delivery room to the clinic,
Yep.
build rapport with patients. So yeah.
And it's considered almost primary care too as well,
Mhm.
right?
It
It's
is.
funny because I did not look forward to my OB-GYN rotation at all. I think it was my last rotation of third year, but it's also the rotation I scored the best in, like over surgery, family medicine. I scored the highest out of that clerkship. I got like honors in that, but maybe because I knew how to study at that point. But no, it is interesting. Like for me, if I could have done more OR, I think I probably would have maybe got into it,
Mhm.
like our classmate Jay.
Mhm. Yes. Yes.
So, but no, that's dope. That's super dope. It's just like when I came in, I thought I was gonna do neurosurgery, but it just didn't fit me.
Mhm.
And after a long process, I wound up picking plastics, and I felt like it was, it fit my personality a lot more. Is that how you kind of felt with OB-GYN too?
Yeah.
Just checked off the boxes that you
It
wanted.
did.
Yeah.
It did.
That's dope, man.
And it's funny because my mom always said that when I said I wanted to be a doctor when I was a kid,
Mhm.
I was like, whatever I do, I know I'm not gonna be a gynecologist. So
Oh, for real?
yeah. So she always brings that up. She's like, it's just so funny.
You just need to
But
get an interview of her doing that and post it in the office. Like, yeah, I would never do this, and put it in like quotation sign and hang it up. That's cool. So I'm gonna go ahead and dive right into it. So what happened? What started the What a Doctor Looks Like movement? Happened a couple of years back. This was a crazy movement. I saw it on CNN, Wall Street Journal, New York Times, Forbes. Like, what happened with that?
Yeah, so I was actually back home for a wedding. I was in a wedding with one of my childhood friends, and then I was coming back to Houston. I was in residency
Hmm.
my last year, and when I was on the flight, there was like a flight emergency,
Right.
and so a passenger was unresponsive. They needed a doctor, and nobody ever wants to answer
No,
to
I
those.
know exactly. I'm not.
But nobody was coming forward, and so I was like, okay. So I tried to come forward, and basically it was a lot of back and forth. They didn't believe I was a doctor. They wanted me to show them like my diploma, which I didn't have on the
Right. Like,
plane.
who cares that? Yeah.
So it was just like this back and forth. And then finally another like middle-aged white guy came forward, and he was like, well, I'm a doctor. They're like, well, he has his credentials, he can help. And they kind of like shooed me off to the side. And so after that, I didn't let it go because I was actually at the time I was doing a lot of stuff with like safety and things like that
Hmm.
from a hospital standpoint. So I basically complained to Delta
Right.
because it was a Delta flight. I complained to them and basically escalated it up. And they were just like, well, here's a free drink ticket, here's this. And I'm like, I'm not doing this for a
Right.
free drink.
Right.
So,
Exactly.
like, somebody could have lost their life. And so from there, basically, I continued to escalate up in the company, met with
Hmm.
the CEO down in Atlanta, Ed
Oh, wow.
Bastian, had them change their policy. So,
Hmm.
literally, about a month and a half after that happened, Delta changed their policy.
Okay. What was
Um,
the policy now, or what did they change it to?
because they said that they were following protocol that typically in a flight emergency that if somebody comes forward and says they're a doctor that they're supposed to show their credentials and do all this stuff. And so it was a pretty outdated policy, and so I
Hmm.
was showing them different articles and stuff that said they should have updated it in the sense that, and with the FAA regulations, that in an emergency you don't have time for all of that. So
Right.
you're of course you're going to crack somebody's chest open like, yeah, we need to
Yeah.
see credentials.
Exactly.
But just to be able to assess, like initially, you should be able to state your credentials, where you work, and then be able to assist the passenger. So that was one of the things that they had updated. And then basically it came out to be when the flight attendant was like, well, you didn't look like a doctor. I'm like, what does a doctor look like?
Yeah.
So that's how the whole
Yeah.
thing came about. Because I was like, I had a hoodie, jeans
Right.
on, some gym shoes
And they thought you
on.
were gonna have your white coat on the flight or something,
That
ready to
part.
roll. Crazy.
So that's how the whole hashtag started of like what a doctor looks
What
like.
was some of the like media outlets that you talked to? Like I said, I mentioned. I think I remember seeing it on CNN. I think I saw it on the New York Times.
Yep. CNN, New York Times, Black Enterprise, BET, NBC World News, pretty much all of them.
That's
It was
crazy. What year
everywhere.
was this?
This was in 2016.
So it went
It was
viral. It was definitely
yes,
viral.
and it was my chief year. I was
What did your program say when all this happened?
Ooh, it was a lot.
Yeah, I bet.
So they actually were really supportive. The program was really supportive. I had some attendings that weren't as supportive,
Yeah.
but the program as a whole and the chair of the department was extremely supportive. Some attendings were like, "You need to take this down," because I mean these
Yeah. They're
media
probably the more
outlets
conservative ones, right?
a little bit,
Yeah.
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 And they were coming to the hospital. Like they were
Oh,
waiting for
okay.
me outside the hospital. They were calling into like board conference rooms at the hospital, trying to verify if I was a doctor, trying to verify if I was really 28 years old.
Right.
It was just like all these different things. And so it was a lot, but I refused to take the post down.
Right.
And so, but my program supported me in that.
Oh man, that's good. Yeah, because I can only imagine like the more conservative ones feel like you need to take this down. It's drawing unwanted attention to the
Yes.
program and this, that, and the other. And what are the patients gonna say? No,
Yeah.
I totally get it. And what did how did your mom and your family and friends how they receive it?
Everybody was super supportive. My mom was my parents were kind of thrown off
Hmm.
because they also had reporters going to my parents' house in Detroit. And so my mom was like in her robe.
It's crazy how they can find everybody, right?
Literally. And I'm such a private person.
Yeah.
And so this is before I really had much of like an Instagram. I didn't have
Mhm.
any of that. And so I was just like, how did they find my family? They were
Mhm.
contacting like ex-boyfriends. I mean, like it was
That's
nuts.
crazy.
So, but they were all supportive and everyone was like, look, Tamika, like, and I was just at a point, I was in my chief year residency. I had already gone through a lot of trials and tribulations. And I just felt like this is what it's like to be a minority physician
Yeah.
and be questioned and,
Yeah.
like, why are you here? Show your badge. So it just like, I was tired of that. So I was like,
Mhm.
I'm not going to be silent about
Right.
this. I'm going to leave it up and whatever happens,
Yep.
happens. And I was
f-
interviewing
I
for
feel
jobs.
I feel like it should almost be a day just to draw attention to it. like once a year, like it should run rampant.
Yeah.
It should go viral again, just to remind people, because after time, people kind of forget, it kind of settles out again. But yeah, we should definitely figure out some type of social media challenge to like make it happen like once a year, whether it be the date that it happened on or
Mhm.
whatever, and just just make it flame up all over again. I feel like once a year, just to remind people, like that person in a hoodie has an MD and lots of credentials.
Yep.
I think that would be super dope.
Yeah.
You say you went through like a lot of trials and tribulations in residency. Is there anything else that like was really like daunting that you had to deal with during that time?
I just felt like, and I don't think my story is any different than most minority
Right.
physicians,
Right.
but just being questioned, having to prove yourself, having to
hmm
work twice as hard as the person next to you,
Right.
make people know that you deserve to be here too, that you
hmm
earned a spot here too. So I actually matched initially in a program in Ohio
Right.
at University of Toledo, and yeah, it was
That's rough.
toxic.
Yeah.
It was
Yeah.
toxic,
Malignant.
and it was a lot of issues when it came to that, and I didn't like it, and
Right.
so I transferred as a second year resident, and then things were a lot better. And of course, you're still gonna have some of those things
Of
that come
course.
up and be questioned, and that's some of the stuff like that I've talked about using my platform to
Right.
talk about those different things of being questioned or people stopping like, no, we're looking for the doctor, and I'm like, yeah, I'm the doctor.
Welcome. Did you ever deal with like imposter syndrome or anything like that?
Oh, for sure.
Yeah.
For
Yeah.
sure.
How'd you get through that? Or how did you manage it? Because I don't think you ever like just get rid of it. It's like almost like a management type deal.
Yeah, I think continuing to speak to people who
hmm
are in places that I want to go
hmm
or talk to people who are achieving the same things as me to just kind of be like, hey, I
Yeah.
deserve to be here.
Right.
And then also just sometimes I'll go back and I'll look at my CV
Yeah.
and
Yeah.
it makes me feel good. I'm
Yeah.
like, I did
I
that.
was like, I can't believe I did this.
Yeah.
I know for me, I think it didn't happen till like fourth or fifth year, probably more towards the end of fourth year. And then it was almost like a light switch. It was just like, man, I know more than these guys. I know what I'm
Mm-hmm.
doing here. I remember we had our southeastern conference, and we did like a scholars bowl type deal. And I was the one answering all the questions, and I was just
Mm-hmm.
like, I'm looking around like, man, I've been jumping. So I think you just need to like really celebrate those successes, or like keep those in mind, to like to get you through those dark times. And it's funny because it sounds so cliche, but it really does work.
Mhm.
That's
It does.
crazy.
And I'm surprised to hear that you felt that way because
Oh,
the
absolutely.
way our whole class always views you. I mean, you were like top of the class. You were just like,
No,
we're
man,
so proud of you. So.
man, I was definitely not feeling it.
It's real.
All right, so I'm gonna switch gears a little bit. So, what is some of the things that you like currently in your practice, whether it's surgery or delivering babies, or I know you have a medical spa, parts of your practice. What are some of like your favorite procedures, or what gets you out of the bed in the morning, so to speak, to go to work?
I enjoy operating. I
Yeah.
do. I enjoy myomectomies,
Okay.
taking out fibroids.
Fibroid slayer.
Yeah. Because it impacts so many of us. Like so many of my patients are Black and brown patients and they have fibroids. They've had other doctors kind of pass them over because they don't
Yep.
want to operate on them, too complicated.
hmm
Or just like, oh, just take some ibuprofen, you'll be fine.
Right.
So I think really being able to make a difference in the community by saying like, no, you actually have 6 fibroids. Like, let's
Right.
take them out. And then I get in there and there's 16 fibroids, and they just feel so much better
Right.
afterwards. So I really enjoy that because it makes me feel good.
How young do you usually see patients coming in for fibroids, or at least
Um,
in training or whatnot?
Typically in the 30s, but I've seen some
Okay.
in their 20s.
That's crazy.
Yeah,
No,
but typically I see 30s and up.
like my mom, she did a total hysterectomy. Like, what is it? The one where the ovaries she had everything taken out.
hmm
She had really bad. She had a huge fibroid. It may have been multiple fibroids, but I know she had a really huge fibroid, and it was like the week of my graduation from college because she was so anemic.
hmm
And so I remember that, and that was right before like a couple of weeks before I started Meharry. So
Oh, wow.
yeah, I think about that a lot when people say want to advocate for patients with fibroids. Um, One of my biggest things in practice that I see a lot, sometimes I'll notice them once I go to sleep. Like, I'm like, oh, you have a lot of visceral fat. I'm
Mm-hmm.
palpating on them. Like, I may not be able to lipo as much and get you as flat as possible. And then I'll get to the OR, they go to sleep, and I'm like feeling on, I'm like, it's a huge mass here.
Mm.
And so, when they wake up, I'm like, I need you to check with your primary care doctor and get a CT scan because I felt something that felt huge, and it may be a fibroid, but just to be on the safe side, you need to look into this. And that's something that like I've had to incorporate into my practice because in residency, I didn't see that a lot, even when I was in Ohio before I moved down to Miami. But my patient population significantly changed to more Black and brown patients now. So, no, that's impressive. One of my big things in practice too is like birth control and blood clots. So what is the actual risk, or what is like with the various different types of birth control that have an increased risk of clots? Because you hear it like in that last part of the commercial when they start talking all fast, like this may lead to this, da, 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 da. And so like for me, like I prefer them to stop their birth control a couple of weeks or 4 to 6 weeks before surgery just to minimize the risk of clots. But speaking to someone that deals with it every day, what would you say is your recommendation, or what are your thoughts on like DVTs and birth control?
So technically, if they don't have any type of clotting disorder,
Mm-hmm.
they should be fine on birth
Okay.
control. The unfortunate part is that a lot of times patients get on birth control when they're young
Mm-hmm.
and they've never had. You don't know until you know. You know what I
Right.
mean? That you have a
Mm-hmm.
clotting disorder, and that's usually how they figure it out.
Gotcha.
Is by getting on birth control, or sometimes having a baby, or sometimes having surgery.
Mm-hmm.
Then they realize when they have a heme workup that they actually have a clotting disorder. But in patients that are like completely normal, healthy, don't have any issues with their clotting cascade and things
Right.
like that, they should be able to take birth control
Okay.
and continue it up right until surgery.
Okay. All right. That's good to know. I'm probably still gonna make them stop it.
Yeah, I mean, that's fair. That's fair.
Because I mean, a lot of them are younger, so it's just like
They probably don't know if they have it.
Exactly. In terms of like blood clots in pregnancy, like things that I've been running into are like patients that recently had an abortion or a miscarriage, or just recently were pregnant. What's a good opportune time? Because they'll be like, I just had this baby, I'm ready to get snatched. What's a good time frame would you say is good for them to possibly start thinking about getting a lipo or a mommy makeover after they've had a baby?
That's a good question. It's been heavily debated.
Yeah, I know. That's why I wanted to get your thought, because I've heard 6 months and I've heard a year, but usually no longer than a year. I think it's fine.
Yeah.
If their weight is stabilized, they're not breastfeeding, and they've basically returned to their normal selves. That's kind of like my standard.
Yeah.
For a breast procedure, if they've stopped breastfeeding probably like 6 months and not really like actively like still lactating, I think that's fine. But it's just such a hard thing, so I just wanted to get somebody else's take on it.
I say the same thing, 6 to 12 months. 12 months if you're being a little bit more conservative, because your weight's going to be up and down. If you're breastfeeding, the weight, you're probably still going to be dropping weight during that first year.
Yep.
And it takes a while for you don't want to get plastic surgery or lipo or any of that stuff, and then you're still losing weight or having loose skin. So I would say probably 12 months technically, but for patients that are just really anxious to get it done, I think 6 months is reasonable as long as they manage their expectations with their results.
Right. No, okay. Well, there you have it. See, this is the type of information you get for, click liking and subscribing Triggs Table Talks. You get to hear this stuff from the professionals, board certified in themselves. So, you definitely got to keep that in mind. So I know in your med spa practice you do vajacials. Can you tell me what that is?
Yeah. So a vajacial is literally like a facial, but of like the mons and the vulvar area.
Okay.
So a lot of times, like when people deal with like hyperpigmentation, ingrown hairs, boils, furuncles, different things like that. And so it's really clearing the area of those things. And then sometimes if there's like unwanted hyperpigmentation that some, usually women of color that have more melanin, are more like self-conscious about.
Right.
So it's like helping to kind of like clear that area of those things. It's completely cosmetic. It's nothing from a medical standpoint that's necessary, but it's just something that people like to do in the summer, bikini time.
Okay, vajacials. and then tell us like what's the difference between that and a labiaplasty? Because a lot of women will come in and be like, I think I need a labiaplasty when they probably need a vajacial and vice versa.
Well, a labiaplasty is typically like if nobody's perfect, so no one's going to be even, but
Right.
some patients want their labia to be more even.
Mhm.
So sometimes if one labia is longer than another,
Mhm.
or if they're just both really long and kind of like thinned out tissue, then sometimes they want those trimmed.
Right.
Trimmed. And so that's what a labiaplasty is
Okay.
making those. It's a surgical intervention
Right.
versus something we do in the office,
Mhm.
and completely cosmetic as well.
Yeah, okay. All right. Perfect. So another thing, so we talked about the vajacial, we talked about the labiaplasty. Then there's a vaginoplasty.
Mhm.
I know you don't routinely deal with those, but I'm sure you may have had like in consultation women bring it up or may have had one before. So what's the difference between a vajacial, well not a vajacial, but a vaginoplasty and a labiaplasty?
So with the vaginoplasty, it's basically when people are trying to tighten up those muscles,
Mhm.
the perineal muscles.
Right.
And so if you have like a more gaping introitus and you're trying to
Yeah.
make it tighter,
Yeah.
then typically we would cut out like an area and sew it tighter, kind of like after having a baby and there's
Right.
like a tear,
Mhm.
and then just sewing it up a little bit tighter.
Right.
So that is in a different area versus the labia is literally just like on the lips.
Would the Kegels work to help tighten it too, or is that a myth? 'Cause
No,
I know
it's
you have.
not.
I know you have like the debunked myths on your social media, so that I had to throw that out there.
It's not a myth. No,
Okay.
Kegels work. I refer people to pelvic floor physical therapy every week.
Okay.
And so then yes, they teach you how to do different things to tighten up the pelvic floor. But sometimes if there's like looser skin or things like that, sometimes
Right.
people still want surgery.
Yeah. All right. So Dr. Cross, Tamika, we have some tricky Triggs trivia for you today. These are some questions that are just kind of out the blue. Some things I run into in my practice, and I'm glad you're here. I'm just bouncing all my stuff off of you today. And then, you don't win anything. There's no money, nothing like that. I mean, we're not going to shame you or anything like that. Also, remember to click like and subscribe to this podcast to see and meet some of these great people. At the end of the podcast, we're going to drop their like Instagram handles, TikTok handles, their own personal YouTubes, or any way you can get in touch with them, especially if you're in the Houston area or if you just want to fly in and meet Dr. Cross. Like, stay tuned. We're going to drop all that information at the end of the podcast. So, for the first question, someone that has had a recent abortion, whether that's via like oral tablet or had a DNC, what would be your recommendation before they want to like get snatched or have plastic surgery or cosmetic surgery? How long should they wait, you think?
That's a good question. I think 6 weeks is pretty standard for a first trimester loss. Just if they're not very far along, so
Right.
less than 13 weeks, whether it's medical or surgical
Right.
abortion. I think 6 weeks is more than enough time.
Okay.
And then just making sure that their beta HCG or their pregnancy test is negative
Okay.
before.
Gotcha. Because a lot of times, like we'll get both. We'll get the qualitative and the quantitative at the same time, just to be on the safe side. Perfect. How often should women go to the gynecologist? If they're normal, I would say if they don't have any like pre-existing conditions or something like that.
I would say definitely once a year for your annual. And a lot of people, I'm glad you asked that because a lot of people think because our pap smear guidelines changed over
Mhm.
the recent years where we're not doing a pap smear every year, they think, oh, okay, see you in 3 years. And it's
Right.
like, no, you need somebody to examine you and to look in the vagina every single year, even if we're not swapping for cervical cancer. So I
Okay.
would say at least once a year.
Okay. Once a year, guys. Once a year. I mean, males, you should go to the primary care doctor once a year, like I do too. So, at what age should a woman stop seeing a gynecologist, or is there an age?
I don't think there's an age, to be honest. I think as long as you're, kicking and
Yeah.
breathing, I
As
think
long
you
as you have it, huh?
I think you should. I think you should continue going. We do stop screening for pap smears at 65,
Okay.
as long as everything's been normal for the last 20 years of pap smears. But you still should get a vaginal exam. You can still get vulvar cancer. You can still get vaginal cancer.
Right.
So I say until you're dead.
Do you screen for breast cancer at the same time during the annual as well too?
Mm-hmm. We do a breast exam and then we order a mammogram.
Okay. How often should they get a mammogram? Because I'm not sure if those guidelines have changed. Yeah.
They have. So I follow, as an OBGYN, I follow the American College of OBGYN and the American Cancer Society that says
Okay.
every year. There are some different guidelines out there that say you can do every 2 years.
All right.
I don't recommend it.
No, I wouldn't recommend it either. I think once a year is really good. And then my last question is, what's the difference between a C-section and a tummy tuck?
A lot. A C-section, you get a prize in the end.
Yeah.
I guess you get a prize with a tummy tuck too.
Oh, yeah. I like that. A prize at the end.
But a C-section, we're going through 7 layers of the abdominal wall to be able to get the baby out. The bikini cut is usually in a similar area as where you guys do a tummy tuck. Usually do a fan and still incision. But usually the incision isn't super big, maybe about this big.
Yeah.
And I think with a tummy tuck, it's
it can be hip to hip. Yeah, it can be longer than that. Yeah, we tighten the muscles back up afterwards. It's a little bit more involved, I think. The C-section. You don't typically use drains for a C-section, do you?
Mm-mm.
Yeah, we use drains in ours. We gotta drain that thing out. Well, congratulations for getting through that. I told you it wasn't that bad. Just some tricky Triggs trivia, try to catch you off the spot. So now we're gonna dive a little bit more into your personal life, all things Tamika, all things Dr. Cross. So I know like you've had like a very booming social media presence. Just based off your career and, of course, the movement, what a doctor looks like. What are some of the like podcasts or interviews that you've done of note that you feel like, it's like, oh man, I'm like really here, or, you were just really proud of to be in that space?
I don't know that there's one in particular. I think I did the most media coverage back when the What a Doctor Looks Like thing took off. But I also do a lot of things now, talking about women's health, talking about women's reproductive rights, talking about the Black maternal health, morbidity and mortality, and just how so many women of color are scared to get pregnant. They're scared they're going to die. They're scared they're going to get all these different complications. And so I have really kind of moved more to talking about that. I still talk about implicit bias and things like that, but talking about those things I think is probably the most passionate.
What's one of the I guess like what's causing that increase, or when you hear those numbers of like women of color like dying during pregnancies or right after pregnancy, what are they saying like is like the root cause or like one of the root causes of that?
Systemic racism.
There you go. All right. We had to put it out there.
Yeah. I was like, how real you want me to be? I'm like, no. That's what it is.
I mean, you hear about like Serena Williams having like a massive blood clot and they like ignored her symptoms and stuff like that. Or I don't know if you remember a couple of years ago, there was a OB-GYN resident that died at her own program giving birth, which was crazy to me.
Yep. And so that's why it's like you can't, when they've done different studies and controlled for everything else, it doesn't matter how much money you have, doesn't matter your education, doesn't matter your specialty, doesn't matter. None of that matters. Like at the end of the day, you go in, you're a woman of color, I'll turn it in your favor. So just really, that's why I think I've really shifted my passion to talking about that more, because a lot of patients don't know how to advocate for themselves.
Right.
Especially if they're not in the medical field.
Right. Yeah. Do you have any tips for them in terms of that?
Yeah, I think women need to know that you can advocate for yourself. If you feel like you're being ignored, you feel like, you're getting passed over and they're not taking your concern serious, you can find another doctor, you can find another nurse. And a lot of people don't realize that. Yeah. They're like, you can fire your doctor? I say, you can fire your doctor. Exactly. So I think that's important. And then it's also important to have a good support system and have somebody with you that can advocate for you if you're unconscious. So, having, your significant other or family member that can be there to speak up for you and isn't scared to speak up for you.
Right. No, that's perfect. That's great advice. So as an obstetrician, gynecologist, and, a new mother, how has that experience, like going through like pregnancy and motherhood, how's that like changed your practice? And what were some of the things that you noticed like going through it for yourself that you like outside of just being a professional of like, oh, okay, you need to do this, this, and that, you need to come and see me, versus like when you were going through it yourself?
I think, yeah, it brings it like full circle to actually be the patient
Right.
on the other side in the specialty that, you're in. But I think it definitely has made me a better doctor.
Okay.
I've always been compassionate, but I think it's made me even more compassionate. I know like when I first got pregnant, like it took a while before they could even see a heartbeat because I found out like 4
Right.
weeks I knew.
Uh-huh.
And so I had to keep going back for like repeat betas and repeat ultrasounds. And that was so nerve wracking. And so how often, do we have patients that are going through that?
Right.
So it's like, just this fear of unknown. Like, is this real? Can I get excited?
Did you choose your obstetrician?
I did. So I had actually been going to the same doctor for 10 years, basically as long as I lived in Houston.
Okay.
For 10 years. But I changed doctors right after my first trimester.
Okay.
Because I just she was making me very anxious.
Okay.
And
Okay.
I needed somebody that could I was already anxious
Right.
and going through a lot, changing practices and just doing a lot from that standpoint. And so I already knew that like stress was going to impact my pregnancy, but she was like, you're going to lose your baby. You're going to get preeclampsia. You're going to die. And I'm like, okay.
Right.
I'm like, I need somebody that I knew those things,
Right.
but I'm like, I needed somebody that was she wanted me to stop working. She wanted me to not be a physician for
Right.
the rest of the 9 months. And that's just not feasible.
Right.
So I actually ended up going to a different doctor,
Okay.
a male doctor. And he was amazing.
Okay.
Yeah.
You always hear that debate, like male, OB-GYNs versus female OB-GYNs. I mean, do you have a well, I mean, you have a male like OB-GYN, but is there really a difference, or is, does you think gender really matters, or what?
So I had never had a male gynecologist before him. I had seen my old gynecologist partner, and he was it was just for like routine stuff like a pap smear, and he was
Right.
very insensitive.
Okay.
And so I didn't like that.
Right.
He's like, oh, it doesn't hurt. I'm like, how do you know?
Right. Right.
He's like, you're fine. I'm like, have you ever had this in your vagina? You don't
Yeah.
have a vagina.
Right.
So there was that. So I never went back to a male. But Dr. Lee, he was amazing.
Right.
He kept me cool. He didn't try to act like he knew this or
Yeah.
didn't know this, but at the same time, he was very attentive. So I think it just depends on the person.
Right.
And gender
Yeah.
doesn't have to matter.
Yeah.
It just was our personalities just meshed
Yeah.
well.
Yeah. I think that's probably the best thing. So you've had this baby, this lovely little girl. So how has it been, being in private practice, small business owner, building your practice, being a mom, those big three things? How do you, and then taking care of yourself, like self-care? You can't be a great mother or a great physician or a great business owner if you don't take care of yourself. So how are you managing all these things? What do you do? Like, yeah, how are you getting it done?
God.
I heard that.
And a therapist.
Yeah. I'm all about mental health. I have a therapist too.
Yeah, it's important. But I think just really having boundaries.
Right.
And respecting those boundaries. And by you respecting your own boundaries, you make other people respect those boundaries. So, I mean, being a doctor, sometimes when you're off, you're really on. But I've tried to minimize that. Like when
Right.
I'm off, I'm off.
Right.
And so I definitely, kids grow up fast.
Yeah.
So I definitely wanted to make sure that I'm there for those key moments as she's growing up. I don't want to be the mother that's never there.
Right.
So it's been tough.
Yeah.
But I had to kind of restructure, especially being a single mom.
Right.
I had to kind of restructure my entire career
Right.
to be able to continue doing it.
It's funny because I feel like that's like kind of a common question for like when you hear like watch a lot of interviews and stuff for professionals and stuff like that, really successful people, and that's the first time I've ever heard about like boundaries or making very clear and defined boundaries. And if you look at it, like, yeah, that's what it's all about. It's like, when you're on, you're on. If you're off, you're off, and like you have to respect it, whatever. So I'm glad you brought that up. Like that's something I've never like really heard in like some of these interviews and stuff like that. That's dope, super dope. So I understand that you had like your own medical scare a few years back. So when did that happen? What was going on?
So that was in 2018. I had like I was in a car accident, and so just was like a regular car accident. I didn't, we're doctors, we're bad patients. I told them I didn't need medical assistance. Left the scene after they towed my car, and then the next day I woke up and I couldn't. I had no feeling in my hand. I was like, man, I'm a surgeon.
Yeah, exactly. Yeah.
I kind of need my hands.
Right.
So I went and got evaluated for that. And so with routine testing for that, which it just ended up just being kind of just like muscle spasms that just
Mhm.
needed some muscle relaxers. But with the imaging that they did as a result of that, they said, oh, but you have a tumor. And I was
Mhm.
like, okay, I
Yeah.
didn't know I had that. So
Right.
it ended up being a 15 centimeter adrenal tumor of unknown malignant potential.
Mhm.
So they didn't know like if this was cancer. It wasn't enough atypia to call it cancer,
Mhm.
but it wasn't enough to call it benign either. It
Right.
was like right in the middle.
Mhm.
So basically, it was 15 centimeters. It was huge. I had to have a 6-hour surgery, XLAP, right after my 30th birthday.
That's crazy.
So
You've
yeah.
had quite the life in your very short time of being a doctor, just being on this earth, period.
Yes, it was a lot. I was just like, and I was literally, I started my first attending job
Mm-hmm.
in August. Then Hurricane Harvey hit, and then I got diagnosed with that in February, a few months later. So I was just like, I was terrified, especially because I didn't know if it was
Yeah,
cancer. So
right.
I didn't know. They were thinking it was coming from my pancreas. So I'm like, okay, well, pancreatic cancer, I'll probably
Yeah.
be dead in 6 months.
Ugh.
But luckily, it ended up being fine. I
Mhm.
chose a more conservative route.
Right.
They wanted to do radiation and chemo
Mm-hmm.
just in case, but I didn't have kids at the
Okay.
time,
Right.
and I didn't really want my ovaries to be exposed to that.
Right.
Which there's other ways to get around it,
Mhm.
but I opted to do the more conservative thing and just go in for every 6-month imaging.
Right.
And so I literally had my daughter right at the cusp of the 5-year
Oh, okay.
surveillance mark.
Okay.
So
All right.
yeah,
And everything's been good since then, right?
everything's been good. Never came back.
Praise God. That
Mhm.
is a lot. So I understand that there's a lot that goes on being a obstetrician gynecologist in terms of sex and sexual health. What are some of the things that you talk about with your patients, like some of the like common myths that you have to debunk? Like I love that part. Like I wish you would like do it more on your page.
I need
And then it was
to.
another one that you used to do. What was it, like sex talks or something on?
Tease Tuesdays.
Yeah, I thought
Yeah.
that was super catchy too. So what are some of the things that you've had to like dispel on your social media? And if y'all need to find out, y'all need to go to her social media. We'll drop the handle below to see what I'm talking about, to learn more. But like some of the big ones that you've had to dispel in
From
terms
the Tease Tuesday or the myths?
both.
Both.
Yeah. Like 2 of each.
2 of each. Okay. Tease Tuesday. Vaginal dryness. So that's something that comes up a lot. A lot of times people think that vaginal dryness is something like, oh, that's when you get old or when you're
Mhm.
menopausal. But I actually have a lot of patients that have vaginal dryness at a young age.
Mhm.
And so, I think sometimes people are embarrassed to kind of talk about that. But
Right.
definitely, I want patients to feel comfortable talking to their gynecologist about it. That, we can look in and see if there is some type of hormonal imbalances causing that. But we can also try some, different types of lubrication and things like that to assist, or vaginal moisturizers to assist in that. So that's something I talk about a lot on, because especially when I kind of did a playoff when that song WAP came out.
Yeah. I remember that.
So, because everybody just, wants that, wet vagina,
Yeah,
and
that's
everybody
right.
doesn't have
Wet
it.
vagina.
So yeah. So there's that. I just don't like the P word.
Yeah.
But so that's one I talked about on Tease Tuesday. Another one, talking about different sexual positions.
Mhm.
I know sometimes people have discomfort with certain positions, and so I definitely always say go to your gynecologist to be evaluated.
Right.
Because sometimes it could be something like a cyst or a fibroid,
Okay.
that your partner may be hitting. But sometimes just like doing little things, sometimes like everybody's anatomy is different.
Right.
So sometimes just putting a pillow under your, hips to be able to, or just thrust in a different way, or
Right.
do it from the back, or
Yeah.
things like that.
Yeah.
So those are things that I've talked about in a lot of different articles and stuff like Cosmo and stuff.
Mhm.
We talk about different positions, which used to be more taboo, but
Mhm.
getting people comfortable talking
Right.
about those things with your doctor.
Yep.
Because patients are always blushing. They're like,
Right.
oh, we did it doggy style.
And that's
And
why
I'm like,
it's so like important to find a doctor that you feel like close to or open that you can open up to, that you feel, that you can be yourself. You shouldn't be timid about like what's going on with you. The more information we have, the better, picture that we can like kind of guide you into, right?
Yeah.
Yeah. So no, that's awesome.
Yeah.
No, I love your social media.
Thank
I'm
you.
liking everything. I actually took like one of your posts where it was like from ATL, where it was like, where you been? I showed Glory. I was like, yo, we have to do this. Like the patients that like get surgery and like, where are you at? Like you missing your follow-ups. I need to see you. Yeah.
Wow.
So we had to take it. Let's see. Shit, I'm sure about that. Oh, what is something that we don't necessarily know about you? I know that's such an open-ended question, something that we may not have touched based on. I try to like stalk your social media. I even called Jay and was just like, all right, I'm interviewing Tamika. I need to know the tea. What am I missing?
Jay knows everything.
I know. Jay's one of our classmates. He's an OB-GYN in New Orleans.
I'm an author.
Oh, really?
Yes.
Okay. Yeah, I saw that. When did you write this book?
2021.
Okay.
2021
So,
is
like
when it was
COVID.
published. Yeah.
Okay.
Yeah, COVID. So I wrote a book called What a Doctor Looks Like. So I named it after the media movement that we talked about earlier. But it talks about way more than that. So that's just one chapter. But it's really just talking about my journey. Like originally from Detroit, grew up in Southfield, a suburb of Detroit, and just my journey in becoming a doctor as a little Black girl from Detroit, and just the things that I encountered, just identity issues, or just feeling comfortable in my own skin, feeling comfortable with natural hair, and then just my journey to and through medical school.
That's dope. Okay. I need to do a book. Well, I started one. It was more like on how to study for the board, since I did well on the boards, USMLE 1, 2, and 3. And I started it and I just hadn't finished it. It's just sitting on my desktop.
That's every author's journey, though. Like everybody starts and stops, so that doesn't mean you can't pick it back up.
Yeah, I need to get
back
on it.
It's hard.
Definitely. Well, Tamika, I want to say thank you for being here on Triggs Table Talks. I hope this wasn't too nerve-wracking. Thank you for flying into Houston. I really appreciate you. I'm going to be in Houston, I think, in November, so we have to link up again for Afrotech. So I'm going out there for then. And my dad lives in Houston, so I go out there pretty regularly too. So. And now Carter lives out there. My best friend lives out there. So.
Oh, okay.
Yeah, so I have a lot of excuses to go. So definitely going to do that. So thank you for being here. If you guys have any questions or want to learn more, her links are down below. If you want to tell them like how they can reach you, whether it's office, the name of your office, your website, we can drop that down below if you want to shout that out.
Yes. So the name of my practice is Opulence Health and Wellness. Our website is www.opulencewomen.com. And my social media is tcross_MD. So I brought you a signed copy of my book.
Hey, all right. Adding it to the book list.
Yes.
Make sure it's signed. No, don't try to cheat me. All right, bet. Thank you. I'll have this read probably in a week or two.
Yes.
No, this is nice.
Thank
so how can
you.
people get the book?
Oh, it's on Amazon. So if you just type in What a Doctor Looks Like, then yeah, you can find it.
All right, this is dope, man. Well, thank you so much, Tamika. Thank you for being here.
Thank you for
much
having
success, and I'll hopefully see you in a few months in Houston.
Yeah,
all right.
For sure.
All right, guys, thank you for tuning in to Triggs Table Talks. Like, click, and subscribe. Also, for any plastic surgery procedures that you may be wanting or interested in or just have questions about, you can reach out at Dr. Triggs Miami or go to vixenplasticsurgery.com. Your consultation is completely free. You can also see our specials, that we have a lot of great specials, especially at the end of the summer months and coming into the fall. So check those out. Also, we'll drop the links for Dr. Cross so you can get in touch with her or check out her social media. These are the things we do here. So till next time, be safe, and I'll see you again at Triggs Table Talks.